why your dentist is recommending that you get a deep cleaning instead of a regular cleaning. And no, he or she is not just trying to scam you. We're not trying to maximize our profits. It's literally what you need. So if you've ever been to the dentist and you hear those numbers, 3, 2, 3, 1, 2, 4, 5, all those numbers, those are measurements. So what we're doing is we're putting a little ruler in between your tooth and your gums and seeing how far it goes down. We do that on 6 spots on every single tooth in your mouth to determine the bone health. So 1 to 3 millimeters is healthy. 4 millimeters is like gingivitis. If there's bleeding with that, that could be gum disease. Anything 5 and above is gum disease, periodontitis. What this means is the bacteria have burrowed down deep enough that it's causing inflammation, which is causing the loss of bone supporting your teeth. So if left untreated, eventually you're going to lose so much bone like this person is here that the tooth is going to become mobile. Keep in mind the number one reason why people lose teeth is not cavities or trauma, it's gum disease. So what happens if you just say, no, I just want a regular cleaning? Here's why that's not going to fly. Number one, even if you sign something stating, I know I have gum disease and I just want a regular cleaning, dentists have a professional and ethical responsibility to provide standard of care, right? So there's no way a patient can sign consent to substandard care. Let me say that again, just to be clear. Providing substandard care, even with patient consent, can still be considered negligence in a court of law. So if a patient comes in, they need a deep cleaning and they just want us to do a regular cleaning, we can't do that. That's not treating the disease. So you come in, you get multiple regular cleanings, and then down the line you start losing teeth and you want to sue me, you can do that because of negligence. It's like doing a regular cleaning on someone who needs a deep cleaning is like painting the fingernail of a broken hand. Like if you went into the hospital with a broken hand, they're just like, okay, we're just going to paint your nail because you told me to. So if a patient experiences harm from substandard care from a dentist, they can still be held liable. It can still be considered negligence. So then what does the dentist do? The courts will determine that the dentist had an obligation to not provide substandard care. Therefore, they're saying dentists have a right to just not do it. At that point, I usually tell patients, listen, I encourage you to invest in a second opinion. I'm more than happy to give you your record so that you can go to another doctor and have their opinion on this. At that point, they usually realize that we're not just trying to milk their insurance or get a profit. We are diagnosing your gum disease based on objective information, these numbers here. And pretty much anyone who hasn't seen a dentist for several years will start to get gum disease because when you brush and floss, it only goes down 1 to 2 millimeters. So if you have a 3 millimeter, 4 millimeter pocket, even if you're brushing every single day perfectly, flossing every day, you're just not getting down there. That's why you have to come in every 6 months for cleanings if you have perfectly healthy gums. If you have gum disease, you're going to be coming in for deep cleanings and then every 3 months for maintenance cleanings.